Dear fellow SJM members, thank you so much for making me your 2021 Glaser Award recipient. I'm particularly honored because this is an award that celebrates generalism, and that's been a big part of what my career has been about. I'm also humble looking back at all the prior award winners, including many people who were my inspirations and mentors early in my career, people like Al Tarloff, George Engel, Dave Sackett, and John Stokel here at Mass General, who taught me the real meaning of patient-centered care. I'd also like to give a shout out to Paul Greiner, who was Chief of General Internal Medicine at the University of Rochester, where I was a senior resident. I was that resident who always liked the last rotation they did. All my colleagues were deciding on subspecialty fellowships. I couldn't decide. It seemed like such a problem. Paul called me aside and said, Michael, liking everything is good, not bad. And if I got a specialty for you, general internal medicine, he also turned me on to SJM. I've grown up with SJM, and I'd like to thank all the people who supported me, members of the councils I was on, members of those external funding committees that did such great work. You know who you are. Our wonderful staff, including at the time, David Carlson, who was a great partner, Kay Ovington, and the many other people who support SGM and its mission. I'd also like to thank my more recent inspirations and mentors, people like Jack Wenberg, Al Mully, Jack Fowler, all my research teams here at Mass General, the many SGM members who were part of the Inform Medical Decisions Foundation, where I was president. Our mission was to inform and amplify the patient's voice in healthcare decisions. People like your current president, Gene Kuttner, and council member Mike Pignoni were part of the foundation, as were many other members. I'd also like to thank my MGH colleagues who supported me, inspired me, and covered for me over the years, and my former primary care residents who taught me so much and have gone on to do great things. Gail Dahman is one of them. She's on your council as well. Finally, I'll say I've grown older with SJM, but SJM doesn't seem to age. It's rejuvenated by its new members who are going to go on to do great things in general internal medicine. There are many challenges to tackle, including the coronavirus pandemic and trying to root out systemic racism that's behind so many of the health inequities that plague our country. So lots of work to be done, but I'm really excited to watch all of you and see all the things you'll accomplish working together under the umbrella of SJM. Again, thanks, be safe and careful, and do great things.